welcome to another informative episode of the Anti-Pharmacist podcast. On today's episode, we will be discussing an issue that has plagued the pharmaceutical and healthcare industry not only in Nigeria but worldwide. This is the issue of fake drugs, more scientifically known as counterfeit medication. Did you know that people unknowingly consume counterfeit drugs every day, even in developed countries with well-regulated healthcare systems? According to the World Health Organization, 10.5% of medications worldwide are fake. Also, 1 in every 10 medicines fail in low and middle income countries because they are substandard and falsified. WHO also reports that around 1 million people die every year because of fake medications. Majority of who live in Africa, where an estimated 200,000 individuals die as a result of fraudulent anti-malarial medications. You might then be wondering, what are counterfeit drugs? What are the sources of these fake drugs? And how do they even get into circulation? How can they be identified? How can they be removed from circulation? And what measures are regulatory authorities taking to remove them from circulation? All these questions and more will be answered on today's episode. So, let's get right into it. What are fake drugs? They are drugs manufactured and packaged to look like legitimate brand name medications, but often contain little or none of the active ingredients listed on the label. In some cases, these fake drugs simply don't provide the needed therapeutic value since they lack the active ingredients. Some counterfeit drugs contain real antibiotics or antivirals at a much lower dosage than listed on the product labels. Others might also contain medicines that appear where they aren't supposed to be, which can lead to overdoses and deaths. In the worst case, some contain dangerous products. Some have been found to contain mercury, arsenic, rat poison, or even cement. Based on these definitions, fake drugs can be divided into 3 categories, which are substandard drugs. These are drugs with less than stipulated active pharmaceutical ingredients. They do not meet the manufacturer's quality standards or specification, and also includes drugs that have expired or which were not stored properly. Therefore, the active pharmaceutical ingredients in them have degraded over time. There's also falsified drugs, which are the ones that are deliberately and fraudulently misrepresented in terms of their identity, the composition, or source. These include authorized drugs that have been stolen and resold, unauthorized drugs that have been repackaged to look like brand name products, or fake drugs that don't include the active ingredients listed on the product label at all. The third category is the unregistered or unlicensed drugs, which are medicinal products that are sold in the market where they have not been evaluated or approved by health authorities in that country or region. Some of these products are brought into the country illegally. They are smuggled in, so the regulatory authorities are not aware, and they are being sold without those authorities actually testing them for safety and efficacy. In context of Nigeria, these are drugs that do not have NAFDAC number. Although these drugs might be effective in treating disease, the lack of regulation makes them unreliable, unsafe, and risky for consumption. Now, to the sources of these fake drugs. It is a harsh reality that the advent of technology, which aims to make life easier for people, also comes with negative consequences. The emergence of online pharmacy stores, especially during the COVID-19 pandemic, whose aims were to make medicines more accessible for the populace, also brought with it the problem of proliferation, circulation, and easy access to fake medicines by unsuspecting individuals. Online pharmacies in Nigeria are still at their infancy, and the pharmaceutical regulatory body in Nigeria, the Pharmacy Council of Nigeria, PCN, is only just putting regulatory checks in place. So, in essence, they are not as tightly regulated as the physical pharmacies. This doesn't mean that all online pharmacies are dangerous, not at all. As long as they are registered with PCN and have a licensed pharmacist you can contact each time you want to order your medications, you're safe. I'll be doing an episode on online pharmacies and what you should know about them soon on the show, so you should watch out for that. But the major problem lies with some online stores who are not pharmacies but have added medicines and supplements to the categories of products they sell, even cosmetics. Just in case you don't know, NAFDAC is also in charge of regulating cosmetics because they must meet specific standards since you apply them to various parts of your largest organ, which is your skin. So these online stores start selling drugs and supplements that they might have procured from unknown sources without the supervision and expertise of a pharmacist to guarantee authenticity. I know that you know some of these online stores that I'm talking about because I will not be mentioning names. I just hope that regulatory authorities are doing the needful to stop these unwholesome practices. Of course, online stores are not the only sources of fake drugs. Many are bought in the open market. Many people know of a popular drug market in Lagos and have heard stories of how NAFDAC time and time again have clamped down on some of their operations, sealed several premises, and seized a lot of their products. But like stubborn grass, they spring up again. Being in Nigeria, you know how difficult it is to enact regulations. A lot of these traders do not care about the human life as long as they make their money. They couldn't care less about who is affected by their substandard products. These products cause a lot of harms, including organ damages, physical deformities, mental and psychological abnormalities, treatment failure, which leads to resistance, a major global health challenge right now, and ultimately death. It also has economic implications as people's money will be wasted on medications that won't treat their condition, which will rather cause more harm to them, for which they have to spend even more money. Also, the legitimate pharmaceutical industries that produce these medications will lose some of the market to these unscrupulous individuals. Therefore, the general income generation for the country is even reduced. In 2022, the WHO flagged 4 substandard cough syrup brands from an Indian pharmaceutical company, which were linked to the death of 66 children in Gambia. These products were found to possess excessive levels of diethylene glycol and ethylene glycol as contaminants. These chemicals, the diethylene and ethylene glycol, are antifreeze agents. Also, a while back here in Nigeria, a mother posted online how she found methylated spirit in a bottle of vitamin C drop which she has bought for her infant. Imagine the wickedness. Thank God she was observant. She would have just given that to the poor child, and who knows what damage that would have caused. Consumers are bound to fall into the trap of these fake medicines because of their affordability when compared to the authentic ones. But then, why wouldn't they be cheap? They are substandard and most likely do not contain what they ought to contain anyway. Nigeria comes second only to India, according to international statistics, in the production of counterfeit medicines. This is very disturbing. And while we have to trust the authorities to keep doing their best in enforcing the regulations and removing these drugs from circulation, we can't leave it to them alone. Consumers must be equipped with the right knowledge and be able to distinguish between counterfeit and authentic medications, know what to look out for and where to get their medications. Categories of drugs that are mostly falsified are those in high demand by the populace, from pain relief medications to anti-infectives like antivirals, antifungals, and antimalarials. Even cardiovascular drugs are highly falsified. Therefore, while the regulatory authorities have taken some measures like the Mobile Authentication Service (MAS), which provides authentication code which will be scratched and sent to the appropriate numbers for verification, these are usually affixed to the packs of the authentic products. There is also NAFDAC registration number and the Standard Organization of Nigeria seal. There are also some private companies and startups that have joined the effort by using technology to make detection of fake products easier. There is RxAll, whose product is RX Scanner, an instant drug quality tester, which according to them identifies the quality of drugs within 20 seconds. Also, there is another one called Checkit Technologies, which has a mobile app to check authenticity. We can take advantage of all of this to ensure authenticity of the products we get. Pharmacists, on the other hand, are doing their bits, like I am doing right now, to educate the public and ensure appropriate sourcing of medications. The responsibility then lies on the consumer to join these bodies by utilizing the information gotten. Distinguishing physically between fake and the authentic drugs may be difficult because most of these perpetrators have perfected the act of mimicking the real product. So don't rely on comparing the drug packs or sachets or even the capsules, the tablet, the colors, and the shapes. All of that may not be enough. Get your medications from registered pharmacies only, not from street hawkers and the likes. If you must buy your medicines online, make sure that the online pharmacy has a registered physical pharmacy outlet with a registered pharmacist on site. If you suspect that a drug is fake, which you have bought, take it to the nearest pharmacy and notify your pharmacist. They will help you clarify its authenticity or notify appropriate authorities as the case may be. And this may help save someone else from consuming that same medication. This can also help to trace the counterfeiters and bring them to book. Look out for NAFDAC registration numbers on the product package. This means that NAFDAC has carried out the necessary tests to ascertain its quality and safety and has certified it as authentic. I know some Nigerians do not trust NAFDAC numbers, but we have to give credit to our authorities as they are trying their best even though we may not see it. We just have to trust them. Like the late Prof. Dora Akunyili, God rest her soul, did everything in her power to fight fake drugs while she was the Director General of NAFDAC. So also is the current Director General, Professor Christiana Mojisola Adeyeye, doing everything to stop these fake drug peddlers. Fake drugs worth trillions of naira have been confiscated and destroyed over the years in various parts of Nigeria. Every once in a while, visit the NAFDAC website to see news about drug regulations in Nigeria. You just might be surprised with the amount of information you are oblivious to, which most likely will be useful for you. A concerted effort on the part of the authorities and the consumers will lead to the eventual fall of these fake drug empires. If they don't have people buying their products anymore because people have become wiser, sooner or later they will exit the market and the supply chain of pharmaceuticals will remain reliable. After all, demand is what feeds supply. That's all I have for you on today's episode of Anti-Pharmacist Podcast. I've educated you on fake or counterfeit medications, and I believe that this information was very useful for you. Please share with as many people as you can because I'm sure they will find it useful as well. Also, leave your comments, follow and subscribe to the podcast and help us grow as we bring you more relevant and informative health content. You can also contact us via email at anti-pharmacistpodcast@gmail.com with your questions, comments, or other concerns that you might have. Even suggestions are welcome. Do not be penny wise and pound foolish. Buying an expensive medicine that is authentic is better and more economical than buying a cheaper medicine that will harm you. Safeguard your health by getting your drugs from authorized and reliable sources only. If you suspect the particular premise where fake drugs are being sold, please report them to the appropriate authorities. You can also help in the fight against these fake medicines. Till next time, stay healthy and God bless you.